in Nebworth. What do you understand to be the situation then? I note from The Guardian, which I'm sure you'd agree, Doctor, is not a newspaper known for its anti-union views, that there is genuine concerns that there will not be provision for life or death care, A&E, critical care and maternity services. What do you understand to be the situation there? Good morning.
Good morning, Nick. So I know that I've got a lot of my GP colleagues and consultant colleagues who are going to fill in the gaps as much as possible. So I've got some reasonable confidence that urgent and emergency care will continue to be met. But the problem is that you can't just divide the urgent and emergency from the elective, and they do impact on each other. Sometimes elective becomes emergency. There is absolutely no doubt that health services as a whole in the country are going to be affected, and patients will be disadvantaged. I hope not come to harm. But, you know, I've got patients coming in to see me this morning who will have had procedures cancelled this morning that they've been waiting years for, not months.
I think, broadly speaking, they enjoy huge public support. But was this necessary? 72 hours, Doctor?
So, once again, I support the junior doctors. I think this is, once again, actually their pay is, it does need to be addressed. I do think the British Medical Association, the question I'd be asking them, is it too long? So once again, that is incredibly disruptive. The second thing is that if this has been going on since 2009, why have we let it crescendo to this point? Why have we got to the point where actually it's 35% and it's 3 days? I can't help thinking that drawing some comparisons to being a barista in a coffee shop is not going to win the public support. I think there's other stronger arguments that could be made, and perhaps a lesser form of impactful strike action. But there's the point of strike action, I suppose. Once again, it's incredibly worrying that it got to this stage so late for me.
Noting you're not a politician, you do a far more important job as being a doctor. But when you read Steve Barclay, the Health Secretary, in the Sunday Telegraph saying these demands, quotes, are simply unaffordable, how would you respond?
Well, I think broadly speaking, they are unaffordable, and I suppose I think 35% is not is more of a headline grabber for me. I've looked at the figures. I think that the figure is less. I think my worry is, Nick, is that actually I think that the nurses' strike was one that I broadly had a lot more sympathy for, and I don't mean that you've got degrees of sympathy. What I'm worried about is that if this dilutes the action from nurses and from ambulance workers and from other people in healthcare, then I think we've got a bit of a problem, because what we've got is a massive unaffordable hike in wages, where actually I think some parties in the health service who could do with it more, where we're hemorrhaging more staff, perhaps should have more attention. I mean, that's my only fear about this.
Enjoyed our conversation, Mike. Thank you. Dr. Mike Smith, health commentator and GP partner in Nebworth. Listening to that is Andrew Fisher, who's former director of policy for the Labour Party under Jeremy Corbyn's leadership. Wrote the manifestos in 2017 and 2019. Andrew is also a columnist for the I newspaper. And just to clarify for listeners, there does seem to be a range of requests. Most of the protests seem to be for a 26% lift in their earnings. Some are calling for 35%. In any event, Steve Barclay says that it's unaffordable. He says a 26% lift would cost an extra £2 billion to the taxpayer. Look, I would happily take £2 billion, but in terms of running a country? Well, let's put that to Andrew Fisher. Simply unaffordable, says the Health Secretary. Andrew, good morning.
Good morning. Well, let's first of all clear up the figures. So their pay has been cut by 26% over the last 13 years now. If you want to put it back to where it was, that takes a 35% uplift, because you're starting from a lower base. So the percentage increase to get back to where you were is more than the cut in percentage terms. But that's just a kind of mathematical anomaly. The junior doctors have published the data on this, and the BMA rather, which says it costs about $1 billion, because of course doctors pay quite a lot of tax and national insurance and all the rest of it, and paying off student debt and so on. So actually the net cost is only about $1 billion. And to put that in perspective, that's about a quarter of what the government wasted on unusable PPE during the pandemic. It's not a huge amount in terms of the NHS. It's about 0.7% of the NHS's budget. So it's not a massive amount to raise in governmental terms. But the bigger question is this: there are 9,000 doctor vacancies in the NHS. We need to recruit and retain more doctors. And you're not going to do that if, as you heard from the junior doctors that you were interviewed earlier, they're not happy with their pay, They're looking abroad and saying, actually, I can earn 70% more in Australia, I think was the figure given. This is a global market, same as it is for nurses, and we have 47,000 nurse vacancies. So I don't think it's useful to try and divide up, should we give more to nurses, should we give more to doctors? Actually, we need to look at what we need to run a health service, to tackle the huge backlogs we've got, because this has built up over years. We've had nurse shortages for years, we've had doctor shortages growing for years. There are 4,600 fewer GPs now, fully trained GPs, than there were 10 years ago. This is a real problem, and until we address this, and part of that is pay, we're not going to tackle the backlogs. We're not going to tackle, Jeremy Hunt is saying this week, I want more over 50s to get back to work. A lot of those people on waiting lists, waiting for an operation, who can't work at the moment because they're in pain or perhaps can only work a limited amount, are on an NHS waiting list waiting for an operation. So the sooner we get this resolved, the sooner we give people the pay they deserve, the better it will be for the economy as well in the long run.
Andrew, thank you for walking us through those figures. I'm very grateful, not just for me, but for my listeners. One last figure, though, 72 hours. Did it need to be 3 days in your view?
Look, it doesn't need to be any days. Look, if the government paid up, then we wouldn't have strike action. And the junior doctors, I think, went into dispute in August. They had their ballot from December. There's been a long time where the government could have been talking to them and didn't. So it's on the government, really. You look at the firefighters, they balloted for strike action. They got a much improved offer and they accepted it. There wasn't a single day of strike action. So these things can be resolved without strike action.
They're never going to get to 26. They're never going to get to 26 or 35, though, are they, in fairness, Andrew?
They might not in 1 year, but actually over a number of years, we might want to get back to that level, because this is only what they were being paid in real terms, 10, 13 years ago. So I think it is a reasonable, perhaps long-term demand. Maybe they won't get it all in year one, but certainly they deserve a better uplift than the one they've been offered.
Grateful for your time, Andrew Fisher. Thank you. You are a columnist with the newspaper. You are Director of Policy for Labour. Under Mr Corbyn's leadership, you wrote the 2017 and 19 manifestos.